All right. So good morning. Today's training is on accreditation, licensing, and reimbursement for recovery residences. I'm going to go ahead and introduce myself and then hand it off to my co-participants to introduce themselves. So my name is Milena Stott. I'm an outreach and engagement specialist for the Fletcher Group. Our focus at the Fletcher Group is to increase the quality and capacity of recovery housing in Washington State. A little bit about me and my background. So I am a social worker and drug and alcohol counselor by training. And I've worked in Washington since 2004 in our community behavioral health systems. And within that capacity, also worked within medication assisted treatment programs, within criminal justice programs, and opened a residential treatment facility that provided detoxification services as well as residential treatment services. So I know a little bit more about the Medicaid reimbursed side of the recovery landscape. I will let Alan introduce himself, followed by Carmen, and a quick hello from Justin. Alan, off to you.
All right, thanks, Melina. So I'm Alan Mua. I am the current chair of the Washington Alliance for Quality Recovery Residences, but my day job, I like to say, is as the executive director of New Earth Recovery. So we now operate 5 recovery residences in Skagit County. And just opened up our 5th house within the last couple weeks. So it's been busy around here. Have been at this particular line of work for about 9.5 years now. We opened in 2011 and with our first house, and we've been growing ever since. And so during our conversation today, I'll be talking a little bit of how WAQRR, what our accreditation process looks like, and how it is and isn't connected to licensing and so on. So, it is great to be with you all. Carmen.
Hi, I'm Carmen Long. I am the vice chair of WAQRR, Washington Alliance for Quality Recovery Residences. I also have a day job similar to Alan. I am the director of Truly Motivated Transitional Living, and we're out here in Thurston County. And we have 4 recovery homes out here, and just are celebrating our 15th year in operating. So just glad to be here with you guys today and be able to share some information and knowledge together.
And then I'm Justin Cram. I am the coordinator of accreditation and professional development for the Washington Alliance for Quality Recovery Residences. I also have experience working as a case manager for the state opioid response program at Catholic Community Services in Burlington. And then prior to that, I was the youth drug counselor at the Bellingham Catholic Community Services. And this is my day job.
Well, welcome, Carlos and Travis. All right. If you have any questions through the course of this presentation, please feel free to use the chat box function. And Justin will help me answer it. So I wanted to start us with a little bit of grounding on definitions. I like to do this so that we're all kind of speaking the same language and understand the references and language throughout the PowerPoints. So there is this broad term called recovery residences. And within this broad term, there are 4 levels of care. Today we're going to talk about those different levels and how you become accredited or licensed and how you know which process you have to follow. So for the purposes of this presentation, when we use the term recovery house, we're very specifically referring to level 3 recovery residence ASAM 3.1. And the reason for that is because our state has in our administrative codes this definition of recovery houses being attached to getting licensed for ASAM level 3.1. So if you are a recovery residence operator, you may not be as familiar with this term. If you are a behavioral health agency and licensed with the state for Recovery House, you would be familiar with this term. Our state also looks at level 4 as level 3.1 and level 3.5 recovery residential treatment under ASAM. When we use the term operator, we're generally referring to somebody who runs or operates a recovery residence. And when we're using the term provider, we're generally referring to somebody that provides clinical services. This language will become important when we're deciding whether you become accredited or licensed. And so we'll get more clarity as we move on. So a lot of this work has started as a result of House Bill 1528. And we'll talk in a little bit more detail about that House bill in the moments to come. But in this bill, you know, we define types of recovery homes. So these are the different types. So recovery residence is really this broad term of sober, safe, and healthy living environments. And there's multiple levels, levels 1 through 4. A recovery house is defined under our Washington Administrative Code 346-341-112, which is really referring to that ASAM level of care of 3.1. And then recovery home is a generic term used to describe recovery residences such as Oxford House or licensed recovery houses and tribal recovery homes. So I'm gonna hand it off to Alan. Oh, okay. Sorry, this is my slide. So there's differences in the levels of the service bundles, right? So level 1 is really looking at alcohol and drug-free housing environments. There are no clinical services or providers in this level of home. In the level 2, you're looking at a social model recovery support where there are typically some folks that are employed by the home, but they are not clinical providers. With level 3, you start to see those structured support services happen in the home, and those levels require certain types of services that are specific, that can be understood as social support, but also kind of moving into that higher level of structured support that may offer some sort of clinical or provider-oriented services that are defined. You also have the life skills component added into those higher levels. And then with level 4, you have clinical services on site. And so this is not a peer run. This is typically a setting where you're going to have some more traditional services that are aligned with more medical supports rather than social supports that you see in the earlier levels. So typically this level includes some sort of outpatient treatment and recovery residence.
So Elena, I wonder if you could stay on that slide for a second. I want to maybe put a little, just another little different lens on it too, just so if you notice, if you kind of go down and look at sort of where those bars hit along the top there. So if you look at it this way, all of the levels are alcohol and drug-free housing environments. So this is sort of the part of housing, sort of the piece of the housing pie that is alcohol and drug-free. There are permanent and supportive housing. There's all kinds of other places where people can live, but these are folks who have chosen to pursue really an abstinence base of recovery. And then all of them also belong to the social model of recovery. So that, and by that we mean that there's some sort of peer element. It's really important that peers are connected in recovery. You know, the mantra is you can't do recovery alone. And so in order to be considered recovery housing, it has to have a peer element. Otherwise, it's just a hospital, you know. And then if you look if you look at the black categories down there, structured support services start somewhere in the middle of level 2 in Washington state. So so there are level 2 providers that offer really basic kind of connection, really basic sort of infrastructure structure. But then there are other level 2 providers in Washington that will provide some, you can see even life skills, some other kinds of structure. So level 2, I think, is probably the broadest category on this chart, if you think about it. The others are pretty narrow and kind of easy to understand. And in Washington anyway, level 2 has a lot of diversity in it. So life skills starts for some providers in level 2. And then clinical, actually, we're going to talk about it, but actually can exist in levels 3 and 4 in Washington now. And so those clinical services obviously have real specific meanings. So we're going to spend time talking about what's clinical and what's not, for sure. This little pink, I guess, what do you call that? Fuchsia? I don't know, pink little box is just talking about a model that kind of combines in a level 2 house that maybe an outpatient provider would have. So if you're an outpatient provider and you realize that, wow, people who have stable housing do better in our program, so we're going to actually start our own housing, but the clinical services aren't offered in the housing. The housing looks more like a level 2 residence, but the clinical services happen in another building somewhere. And this is really important distinction, because as we're going to talk about, if we're doing clinical services in a housing setting, then a license is going to be required. So anyway, so Milena, sorry to horn in on your action there a little bit. I just wanted to make sure that other kind of way of looking at this got represented. So
no, that's perfect, Alan. Thank you.
So let's go ahead. Sorry, go ahead.
Why don't we pause here real quick? Because I think, Alan, you're taking over on a deeper dive into each of these levels in these next few slides. But let's pause here and see if there's any questions or observations, just kind of based on what Alan shared.
All right. Anything in the chat or the Q&A, Justin? I'm not seeing anything on my end.
I'm not seeing anything on my end either.
All right. Well, let's keep rolling, and obviously feel free to interject along the way. We're a small enough group to where that's no problem at all. So if as Milena was starting to explain there, the 4 levels are fairly easy to understand, with probably the exception of level 2, which has some complexity to it. But go ahead, next slide, just to highlight what Oxford House. Generally, when we think about level 1 housing, we're thinking about Oxford House. There might be level 1 providers out there, or level 1 houses out there that actually there aren't providers. There may be a group of people who decide, hey, we're just going to live together and provide some support for each other. But we may or may not ever hear about them, because they don't need to be accredited. They don't need to be certified. They're just a group of people who make some agreements. Oxford House, on the other hand, has a charter process, and they organize themselves. The house has a structure that's basically residents agree to live by that. But what happens in the house is all peer run. So residents decide who gets in and who needs to leave. They decide what the on the ground policies are going to be, and who empties the dishwasher, and all those kinds of things. All that happens on the ground with the residents. There's nobody, they elect their own leadership, so there's nobody who comes from outside to kind of be in charge of the house. So the next one then is level 2, and level 2, often called sober living homes. Again, that's a broad category. There are a lot of names you can tell of all these. But if you think about a sober living home, there's usually an owner who's an operator who has a set of rules that they want residents to live by, and they can provide all kinds of levels of support within that, but basically there is somebody in charge. There's a house manager whose job it is on behalf of the owner operator. Could be the operator herself or himself, but it's certainly the rules are established, and usually the owner operator is making decisions around who gets in, what the policies are on the ground, and so on. And then, but what sort of the difference we're going to talk about between levels 2 and 3 in Washington is that there's no, outpatient treatment that's happening on the ground. There's no licensed counseling, mental health counseling that happens in the house. Those things happen at the higher levels of care. So, so the next one then is level 3, which we're going to.
Alan, can I
Yeah.
interject real quick? And so this is my piece, right? So if you guys can tell, Alan and I are trying to define like where level 2 is the social model versus like the medical model. What the way that the state of Washington has interpreted is that if you are delivering those clinical services, right, and that's the provider piece that is employed and paid for by the home, you move into that licensure space.
Yeah.
If you stay outside of those clinical services, but maybe you work in collaboration with somebody in your community and they're the ones doing those things, that doesn't trip the wire, right? But it's really around your scope of practice and whether you are delivering clinical services. So once you begin to deliver clinical services or hire somebody that's paid to do counseling within your residence, that's when you move to level 3, which Alan is going to continue to share about.
Mm-hmm. So level 3 then in Washington is what we call recovery house, and recovery house has a very specific meaning. It's in the WAC. So a lot of our, we talk about our residences as recovery houses, and they are in the generic sense, but specifically in Washington, this is a recovery house. So there are currently, last check, 10 recovery houses in the state that actually meet that criteria, and they are licensed by the Department of Health. They are essentially a step down from inpatient treatment. But on the ground, you would see clinical services, medication management, some of those kinds of things. I think, I guess med management, I shouldn't overspeak, but I believe that can happen in a recovery house as well. And then level 4 is what all of us would call inpatient treatment. So again, as long as it's there's some sort of peer connection, which in a really good inpatient treatment, there are peer connections, there are groups happening, some of those kinds of things, and a lot of just kind of living, people living together, learning to do that, that happens there. But very much structured setting, almost always time limited, especially by insurance and Medicaid, all of those. Generally, those are much shorter stays than what you might see, certainly in a level 1 or level 2 home, if you sort of set them side by side. So that's the levels. Let's look at, let's go to the next one here. And so let's talk about 1528, and we'll get back to levels again when we're talking about accreditation versus licensing. But House Bill 1528 passed in 2019, and it does a few things. Basically the healthcare authority now oversees, and it's primarily, I'll just put the overall categories, primarily has to do with levels 1 and 2. So levels 3 and 4 basically get handed off to the Department of Health, but the healthcare authority works in levels 1 and 2. And so first there's a registry of all level 1 and 2 residences that are that fit into these categories. They are either Oxford houses, or they are accredited by WAQRR, or they're tribal houses. So so that's who's in the registry, and I think we're going to talk about that again in a second. But the other thing that the bill provides is technical assistance, and so recovery residences can get in touch with us at WAQRR and ask us any kinds of questions that they want, either about our accreditation process, but we get a lot of phone calls from folks who are just wanting to know, how do I even get started, and where does the money come from to open a recovery residence, or policy kinds of questions like, what do people typically do about this? We get some legal questions, and we are careful about answering those, but we can provide some general guidance around like the Fair Housing Act and some of those those laws that actually do impact both our right to exist, but also they have something to say about how we function on the ground. And then there are two loan funds that were created as a result in 1528. One is an operating revolving loan fund, and that is for they're starting to take shape. So I can tell you now they're $4,000 loans. So if you need $4,000 can help your residents do some things. Often it's designed to sort of get somebody up and going. So to pay first and last month's rent maybe, or to get some furnishings, or to do something that would sort of get you up and going. The next one, the next loan fund, they're still working on trying to figure out, but it's the capital revolving loan fund. These would be bigger loans. As far as I understand, they're going to be bigger loans, and they're going to be for capital kinds of projects. So it could be like a remodel that needs to be done, or just some sort of fund that you would have access to if you just needed a really good something that might help you meet the accreditation standard, or maybe if you're headed toward licensure, this could maybe help you get there along the way. But the details on that one are still not out yet. Both of these are revolving loan funds. What that means is when you pay back your loan, it goes back into the pot for the next people to be able to borrow. And the hope, of course, is that that just stays replenished, and that WAQRR and the Healthcare Authority would work to be sure that folks are paying those things back. And the payments are quite reasonable. And so it's just a nice way to kind of, for someone who doesn't have money in their pocket to start something up, they can get this little start. So, all right. So next is about the registry. So I mentioned this a little bit already, but it is housed and managed by HCA. It is, if it's not up tomorrow, it'll be up within the next week, is my understanding. So, but it's a place where you can go if you're looking for housing, if you're looking for a place to refer somebody, and it's going to include Oxford houses. It's going to include all of the WAQRR accredited houses, and it's going to include tribal houses. So the only exception to that, and this is something that the HCA put into the registry regs, is that if a house does not allow people to come in on medication-assisted treatment, then that house will not be listed in the registry. So you could be, WAQRR will still accredit the house, but you won't be listed on the registry unless you allow residents to receive medication-assisted treatment. More than open to any questions about that along the way, but that's the only sort of caveat to put on the registry. Otherwise, if you're WAQRR accredited, you're on the list. And again, the launch date we're hoping is in the next day or so. But and I think they're on track, but I haven't heard in the last couple of days if they've worked out all the bugs. It's basically going to be a little a map, a little interactive map that you click on your county or your town, and you'll be able to see which Oxfords, which WAQRR houses, and any tribal houses that are there. And the last thing to say about the registry that makes it really important is if you want to get referrals from other entities in Washington State that are providers, so an inpatient treatment provider that's receiving state funding, they will only be able to refer to people on that registry. So really important for all of us to know that our referrals that are coming from state-funded places are going to need to be on the registry. So we've got another 2.5 years or so to be sure that that people are, you know, accredited and ready to go when that switch gets flipped. So we're working hard to get as many people accredited in the fold as we can, so that that doesn't affect them in a negative way. All right. So here's what the accreditation process looks like, and I think our current attendees know that. It looks like we've got something from Travis here. Okay, hey, Justin, can I get you to read that? It disappeared off of my screen, so I want to make sure I answer it.
It says, from a state government level, with this new legislation, are you foreseeing any additional oversight from the state in regard to recovery housing?
I don't think so. That no one's talking about wanting to do more stuff other than what's already required in the accreditation process. So the great thing when we came on board as a contractor with the state, WAQRR agreed to obviously conduct our process based on the nationally recognized standard. And so because we're using the NAR standard, which is nationally recognized, which is quite thorough and quite good, and it's written by experts. So at the accreditation level, the state, I think, is gonna be involved basically via WAQRR, and we'll do that that sort of monitoring work, including a complaint process. That all happens in-house, and we handle that on our end, as opposed to you know, the state being involved. So if the state, this has happened already, if we've had concerns that come to, say, the healthcare authority about a residence, they will get in touch with WAQRR and say, you know, and first of all, they'll ask if this provider is WAQRR accredited, and if so, then we would be handed that whatever the situation is, in order to work with the provider or the operator to get on the right track. So and then the state is very involved in the licensed facilities, which we're going to talk about in a little bit. And so that's where all of the, you know, we're involved with levels 1 and 2. But okay, all right, thanks, Carlos. Hope to see you back. All right, so the process is pretty basic. We start with document review, which is just looking at policies and procedures that are in writing that we can walk through. Operator interview would be phase 2, where we work with operators on just basically the interview is about trying to get to things that are harder to observe by looking at a document, or even doing a site visit, which is the third part of the process. So when we do site visit, doc review, and interview, we feel like we get a really good sense of an organization and how they're complying with the WAQRR standards. And so if all those things line up and they meet all the standards, then they get the accreditation, which is good for 1 year. So here's the web address to go to. You can also go to waqrr.org, which is a little bit shorter to remember, but recoveryhousingwa.org will get you straight to the page where people can start filling out their applications for accreditation.
Alan, just
Yes.
real quick, because Carlos did say that he needs to go at this moment. Are we going to have this recording made available on our website?
Yeah, I think we'll talk about that, and certainly we can send it to anybody who's registered and missed, and we can talk about where we can post it. But I hope so.
Okay.
Yeah.
Just wanted to clarify that before he left.
Great, thank you. All right. Next step is licensing, and I'm going to pass this back to Milena, who's going to talk us through what that looks like at the state level.
All right, wonderful. Thank you, Alan. So just to summarize, Bill 1528 set forward the path to basically saying that, yes, there's some funding available to become a recovery residence. Whether you get accredited or licensed, which is required for you to receive referrals from providers in our community, or be on the registry. When you're making a decision about accreditation or licensure, you're really deciding on your level, right? So if you're a level 1 or 2, you're going to reach out to Alan and the Washington Alliance for Quality Recovery Residences. And if you're looking to get reimbursed for some clinical services under the Recovery House model, level 3.1 ASAM or higher, you become subject to the licensing process at the state. There are two parts to this licensing process, and you're going to learn a little bit about that. There's all sorts of fun links and information and guidelines in the slides that follow. So when I speak about licensing, I'm speaking about folks that want to be a recovery house level 3.1 or higher, which includes residential treatment facilities, and those become reimbursable services under Medicaid. So recovery house licensing in Washington. So a recovery house is licensed by the Department of Health. It becomes a behavioral health agency with a certification to provide recovery house services. The regulations to do this can be found in the chapters in the RCW, of the RCW and the WAQRR, which stands for Washington Administrative Code. On these links here. And so when you get the PowerPoint, these are active links. You'll be able to click on them and it'll take you straight to those regulations. I'm going to go over them as an overview in the slides to come, but you'll definitely want these as references should you decide to pursue this process. So there's a service application, right, which is under the Behavioral Health Agency or the HCA. Or there is a facility application, which becomes licensed by the Department of Health as a residential treatment facility. So really the big takeaway is that the Department of Health oversees the facility side of things, and the Behavioral Health Agency side oversees the services side. So you have structure, and then you have services. So I'm going to go over the requirements to become a behavioral health agency and get reimbursed under Medicaid for level 3.1 ASAM or higher. This regulation requires that you have a governing body, an administrator, which the administrator would have to have the credential substance use disorder professional to be able to be an administrator over the facility. You would need to have appropriate policies and procedures that align with the Washington administrative codes. You need to have some sort of record system. You need to have a human resource process where you're able to provide background checks and training for your employees. You cannot be a personal residence. You know, if you're a residential treatment facility, that's what you are. You're not a personal residence. You have to provide some assessment and counseling services through a substance use disorder treatment professional. In the case that you also employ peers, that individual would be supervising the peer Medicaid services that are reimbursable under that level of care, which is why you need that clinical supervisor. The Behavioral Health Agency residential treatment requirements requires that you use ASAM criteria. It requires that you keep a list of resources, and it opens up the door to creating an individual service plan. The individual service plan is what makes the services reimbursable under Medicaid, and that is why it is a requirement. The other most critical piece is that you're a facility that has 24 hours a day supervision. And so that's that additional layer of oversight. When you are operating services under clinical services under this facility, you are addressing substance use disorders. You are required to have a relapse prevention program. You're required to have conversations about bloodborne pathogens and tuberculosis. You also have to screen for and address emotional, physical, and sexual abuse within the population. You have to address nicotine disorders, and you have to address the impact of substance use during pregnancy. So these are often things that are regulated under licensure that you have to provide. And so through the licensure process and within your policies and procedures, you're speaking to how your program addresses each of these things. A behavioral health agency does also provide residential treatment services under level 3.1. That's at least 5 hours of treatment per week. That's not to say that you can't provide more, but you're required to provide that minimum of 5 hours. And those services are tied to your individual service plan. So this is a little different than skills building. This is more formal treatment, right? Where you're providing the counseling, you're talking about relapse, you're developing skills, all things that fall under services that need to be delivered by a credentialed person. The life skills training and job training can be a little trickier. If that is all you're providing, that does not necessarily make you a treatment facility, right? Because the 5 hours of treatment that you're delivering go beyond that scope in the licensure. So we've talked about the service requirements, and before I jump in to the actual facility requirements, I'm going to take a pause and see if there's any questions.
Shot him an email. You saw it. I forwarded it to you. So
all right, I see that there is a question.
Larry's a year in, so you know it technically.
So Travis, I see, maybe you're still writing. I only see part of your, okay, there we go. When you say not personal residencies, are these supposed to be buildings that are set up for group living, or can single family homes qualify? So the Department of Health has a construction and review process that requires you to meet certain square footage and treatment space requirements. So, you know, so number one is it could be a personal residence that is turned into a residential treatment facility, right? But the idea is that you cannot live in the home. If the personal residence meets the square footage requirements to be a residential treatment facility / recovery house / ASAM level 3.1, if the square footage meets those requirements and you're not living in the home and you want to apply to the department to make it a residential treatment facility, the answer is yes. If you plan to live in the home, even if all those things are true, the answer is no. Or if they don't meet the square footage and treatment space requirements, the answer is no. So the square footage requirements and the group space rooms, you can find that in the WAC that is referenced within this. I don't know that off the top of my head, but you would want to explore or ask questions of the Construction Review Services Division of the Department of Health. And through your application, you're submitting floor plans, and they review those. All right, you are welcome. So related to the facility requirements, we're going to talk a little bit about that now. So in the chapter 246337, it's going to talk about those requirements. So in addition to the square footage requirements, you also have to have a quality improvement program. That sounds complicated, and it can be as simple as like a 5-page plan, right? That talks about how you're monitoring certain things that are happening in your facility, like incidents and things like that. You do have to have an infection control plan, which is, you know, how you control the environment to promote health. The infection control plan, there are many samples on the website, and the infection control guidelines are also outlined in the chapter 246. Again, staff have to be present with one person trained in CPR and first aid. You have to offer food and nutrition services. And then there are also construction standards for the kitchen, the sleeping rooms, laundry. And so this, Travis, takes us a little bit deeper into those square footage requirements. So beyond the square footage requirements, you're also looking at, some of these other requirements. The water, sewage, and waste is really around how you're following the policies and procedures as outlined in the chapter for those things. With laundry, you have to have a certain temperature for the water. For example, it has to be an industry grade washer machine. The common rooms are about the square footage. There has to be ventilation and air conditioning. And so that you can look at the details under each of these chapters. It outlines very specifically what each of those requirements are. And so not only are you meeting them on the application, but you're also submitting policies and procedures that indicate, how you ensure those things. So in terms of what this process looks like, so a behavioral health agency and residential treatment facility applications, they're two separate applications, but they can be submitted simultaneously. If it's a new construction project, most people are going to submit the licensing application first to make sure that the floor plans, for example, meet all of the requirements necessary to become a licensed facility pre-construction, right? So that you don't have to go back and make changes. Both of the applications require their own policies and procedure. One of the policies and procedures, right, to the facility is going to focus more on the operations of the facility and the structure of the facility, whereas the policies and procedures for the behavioral health agency side of the equation is going to focus on the actual services that you'll deliver within the facility. So you have to submit two applications and their appropriate fees. They also require background checks. And then really the time to receive the license depends on the length of construction, right? If it's a new project, they can't license you until they set foot on the completed project and evaluate that, the construction met the details that were outlined in the construction plan as well as the floor plan. Processing the paperwork is done quite quickly, and by the time you apply, you also are able to work with somebody at the department to answer very specific questions, because your case is assigned to a reviewer who can help you process how to make decisions based on the requirements outlined in the policies or the codes. So in terms of step one is the application submission. Sometimes policies and procedures are not written at the time of application submission, simply because you don't have a building yet, right? Or you don't have a service yet. The background checks as well, the minimum requirement at the time of application is that the administrator has been identified, because you're required to have an administrator assigned at the time of the application, and that the background check would happen for that administrator, but then subsequent background checks for the new employees becomes a part of the HR process and is outlined in the background policies and procedures. The fee and the ADA checklist are submitted at the time of the application. The policy and procedure review can happen while construction, for example, is happening. The policies and procedures can also be written during that time. Oftentimes, Projects that are new projects will really focus on the construction first. While construction is happening, they'll write the policies and procedures for the program and begin to hire staff members. But you would want to submit what you have at the start. And you'll notice here the link to the actual application. So the step 2 is the policy and procedure review. So assuming that you have a structure completed and you have your teams ready, you're building your teams, you're building your services, you've written those policies and procedures and you've trained your team to those policies and procedures, the department begins to review them. If amendments are needed, they'll let you know, and they'll let you know very specifically which part of the regulation you need to address. And you submit those edits prior to final approval. Step 3 is an on-site review. So really they're looking to make sure that what you put down on paper is happening when they come to your site, right? So all those things that you wrote about, when they come on site, they're gonna ask you questions about them, and they're gonna look at the facility and do a walkthrough to look at, how what you've written plays out within the facility. And then step 4 is the final approval. So once they've been on site and they've said everything looks in line, they activate your license. So that's the piece for the service licensing. The piece for the structural licensing has 2 processes. The first is the construction review project application. So if you have an existing structure, what you're submitting are the floor plans that you've created or that you have for your structure. And that's what you submit. If you don't have a structure yet and you're building one, the construction review is what they review as the floor plans by the architect to make sure that the square footage and the treatment rooms and the ratio of square footage to number of people, the type of furniture that you have in the rooms, all of that meets the requirements of the state. And those forms and applications can be found at this link here at the bottom. So
and I think we can I interject for a second? The links and so on, I wonder, should we, to Justin, can we post the PowerPoint as well? Any reason why that would be an issue from your end, Milena?
No.
Okay, so if we post the PowerPoint, then anybody can click on those links. So that'll be on our website alongside the video as well. So we'll figure out the best format to do that in. But this would be a great resource for people to have as they're considering going through the process. So
yeah, thank you, Alan.
Thanks for including them. That's great.
So the second step is the submission, right? And when you're submitting the actual application, you're submitting those policies and procedures, the floor plan, the background checks, the fees. And then step 2, they do the policy and procedure review. Step 3, they do the on-site construction review. Step 4 is the Washington State Fire Marshal. So the Fire Marshal has to bless the property. In some jurisdictions, I don't want to say all because I don't know with confidence that it is all, but certainly in the city of Seattle, after the state fire marshal came in to say, yes, all looks in line, the city fire marshal also had to come in. So just be mindful of city processes and requirements too. And then step 5, the license is activated. And once the license is activated is when you can, once both licenses are activated, right? The behavioral health agency license and the residential treatment facility DOH license, when both licenses are activated, you can begin serving your folks. So post-licensure and certification, what to expect. Once the facility has been in operation, they'll come and do a surprise visit. And they may look at, you know, your charts. So they look at your plans. They look and make sure that your structure aligns with your plans. And then they come in after you've been in operation for a little bit and make sure that what you actually designed and wrote to and are doing is documented appropriately in your charts. And then at that point, the facilities are placed on an 18-month survey cycle, and both licenses are reviewed annually. And so the survey cycle is really a simple one. They'll typically notify you within a certain number of days that they're coming, and they'll want to look at a couple of records, and they'll want to walk around and do some quality assurance and make sure that you're still doing all the things that you said that you would do. So in terms of questions and support, so Julie tomorrow is the DOH Facilities Program Manager, and there is also the credentialing program. You can ask the general questions to this phone number or email. If you need a supervisor because you couldn't get your questions answered, Julie is the program manager. She's very knowledgeable about this process. And is able to support questions and answers. Now, I am not with the Department of Health. I have only gone through this process a couple of times. So when I speak of this, it's through the lens of having gone through the process and not having written to the process or you know, creating the regulations. But I think that there are some things that DOH can provide a significant amount of clarity and support on should questions come up. You can also sign up for the Department of Health notifications, and there's a link to subscribe to that. This is how you get notified of, you know, what's going on more broadly in the world of the Department of Health and what's happening with quality and integration. And it's a great way to understand what new policies and procedure revisions are coming down the pipeline, or regulatory revisions, what trainings are available, just kind of what the state is up to in the realm of residential treatment facilities. And with that, I will hand it over to Carmen, who's going to talk about the role of the Washington Alliance for Quality Recovery Residences on providing technical assistance for accreditation. And that concludes the licensing part. I'm going to turn it back over to Carmen to talk about the accreditation.
Thanks, Melena. There we go, back to the rec side. Okay, so biggest picture of WAQRR is that our goal is to stimulate the quality and quantity of recovery residences in Washington state. And then in the more narrowed view, we've got a list here of kind of the ways that we would do that. Offering technical assistance with owner-operators of recovery residences. That might be a phone call, that might be a one-on-one in person. And technical assistance is kind of a broad term for, you know, many things that we would be doing. That TA would also be through webinars that would cover lots of topics on best practices, emerging issues. We would use NAR as our model for those. Our field is very unique. And so it's really, really advantageous for people who are recovery house operator to be able to get together and talk about best practices and emerging issues and different things like that. And NAR would be our standard for those. In-person events, we'll be hoping for some of those. Would be covering recovery house licensing through DOH and Medicaid reimbursement, which we've touched on some of that, a good portion of that today, and we'll continue to do probably webinars on those going forward until things change. And then all-day intensive overviews of recovery residences, what makes a recovery residence, what qualifies as a recovery residence, the NAR model, which we are the affiliate of the National Alliance for Recovery Residences. again, emerging issues, and then back again to the licensing and reimbursement for a level 3 or 4. The other thing that we do is train the reviewer events. So if you wanted to be an individual who goes around and does the accreditation process for levels 1 and 2 recovery homes, then you could be trained to do that. And then fidelity reviews, which would be the actual process of going through and making sure that homes are, meeting the standards of WAQRR. And then the other part here at the end is that we're providing expertise to the HCA on recovery residences in the NAR model. So it's been kind of a collaboration with us and the HCA since House Bill 1528 was passed last year, and just being able to sit around tables with the HCA and kind of educate a little bit, I would say, on recovery residences, recovery homes, and that type of thing. Upcoming webinars, October 22nd, funding sources for recovery residences. That's going to be a really great one. Everybody's always trying to figure out how to fund it and grow it, and there are revenue streams for that. So that'll be on October 22nd. What makes a recovery residence? Again, that's the nuts and bolts of what would distinguish a recovery residence from a house with people just go, 5 roommates go, we want to live together and maintain our sobriety together. What would define an actual recovery residence under our terms? Return to use policies and recovery residences will be in December. That might be known to most of us as our relapse policy. And so what are your policies that you have in place? Again, a good exchange of information on what those policies look like and potentially should look like. And then MAUD, which is medical treatment for opioid use disorder. The name has changed, I think, 3 times in the last year. It was MAT, medically assisted treatment, and then it was MAR, medically assisted recovery. And so basically it's about supporting people who are taking medication to assist them in their recovery process and policies around that. And that'll be January of next year. Whoop. Other professional development opportunities that WAQRR offers: individualized technical assistance and site visits. We also have a 1-day recovery housing basics seminar. Some of this may seem a little bit repetitive, but we basically we're delivering all these in the setting of a webinar like we're doing here today, and would hope to get back to in-person events. So again, it's that networking piece, it's that shared information piece, it's that best practices. It's really exciting to be able to see recovery housing, one, be recognized by Washington State as something that is of great value to aid in the recovery process, but also to bring our programs that we offer and the housing that we offer up to a more professional level. And then accreditation process training for process facilitators. So that would again be somebody who's going to go through a home and do the site visits and those type of thing. We even have a really cool little document library where when someone is doing their document preparation, we've got some templates and some help with that type of thing for the document prep. And here's our contact information: Alan's email, my email, Justin, our coordinator of accreditation and professional development, and then from the Fletcher group, which not necessarily affiliated to WAQRR, but our goals and what we're working on are very similar. So Elena's email is on there as well.
Thank you, Carmen. And just to say a little bit more about the Fletcher group. So the Fletcher group is involved in this initiative related to rural recovery housing and expanding resources and opportunities for rural communities. Having said that, a lot of our work is in partnership with the Washington Alliance for Recovery Residences and the Healthcare Authority, and really figuring out, the space of how we come together to build this ecosystem that is connected to recovery housing or recovery residences. A lot of the work that we do in those higher level facilities is great to support individuals at the start, but the reality is, you know, everybody needs a level 1 or 2 recovery residence to return to continue that journey within a community that can understand and support their needs. And so at last, we open up for any remaining questions that you may have, but then also a question for you on how we can better engage you and some general feedback on how this process went so that we can continue our own process improvement as we grow with our community in these initiatives.
I'll just give a shout out to folks who are watching the recorded version, which we will post, and just to invite feedback on pieces that are missing as well. So we intend to hopefully offer the same training in person at some point, and so just knowing what would sort of fill out the information would be really helpful as well. So feel free, even if you're watching on the recording, to reach out via the contact information on the last slide. And just let us know how we can be helpful in facilitating that. I'll throw in one more thing too, that really one real function, important function of this presentation is for folks who, for all of us who offer a variety of services on the ground. We want to be really cognizant, really aware of what would be a concern in terms of what we're doing on the ground that would sort of trigger the license process. So for some of us, we watch this and say, hey, I want to be sure that that I'm not doing anything that I'm going to get in trouble for doing without a license. But then there's this other group of folks who might be offering a higher level of service, and they say, boy, you know what, I think I'm at the place where we could actually start offering services and get Medicaid reimbursed. And that really is the advantage of the licensure, is that you're kind of in a whole nother level of care where there's funding available that actually comes with the client or resident, and so you sort of cross the line from being what we would call level 2 recovery residents to one that is a little, looks more like treatment. So I think that those two groups are who we're speaking to, and if you're in one of those two groups, we'd love to hear from you about what would be more helpful to learn about in any of those. And obviously the Department of Health will fill in a lot of gaps there too for those seeking that actual licensure.
And then if you are seeking licensure, what kind of supports and information are necessary to ensure that you're successful in that process? Because while the Department of Health can answer questions, sometimes there are additional technical assistance needs that one may have, such as how to write policies and procedures, for example, or how to deliver certain services, and those resources are available through other means. And so it's just helpful to know where people are and what you need, so we can make sure that information is available to you.
Right. Well, if just a few more seconds for any more participant feedback, and if there's none, then we can sign off. Anything else from Carmen, Justin, that you want to throw into the mix?
Yeah, I will real quick, just going back to what I shared about WAQRR and our role in helping to increase the quantity and quality of recovery residences here in our state. We want to help housing providers get accreditation. It's not a process where we're trying to catch you not doing well. It's really actually a process of us helping you do well to get accredited. So it's a very friendly process. It's a very helpful process. We're with you every step of the way. So I would not let the list of things that you need to do to get ready for it intimidate you, because we're here to help with that.
Yeah, and I think it's fair to say too, for whatever it's worth, that the accreditation process isn't quite as lengthy and involved as the licensing process. That'd be a fair thing to say, wouldn't it, Melina? That that knowing what you know and even what you just went over, I was pretty, I think we're pretty streamlined in terms of what we require. We just want to be sure that people are doing what they say they're doing and that it really matches with a set of quality standards that we can all feel good about. So.
Yeah, that's very true. You know, a lot of this is about community building and helping one another do the work that we do the best that we can do it.
For sure.
And so I think that all of us here today come to this work with that mission. I think from the state's perspective, not that I work for the state, but I can understand the desire to grow opportunities for services in homes as we begin to reach populations that have higher levels of need. And so, you know, the way that those policies are written at the state level are really done so from this perspective around learning what the best practice is and how we support individuals by using knowledge and information and systems that we know work. Because this work is challenging and we all need to do it together to be successful. And so I think bringing community and understanding and funding, right, which is really the state's intention around licensing and drawing down Medicaid dollars is all important. And how do we do that in a way that's meaningful and supportive of the day-to-day functions and work that you do in the space that you are? And so I think the four of us here come to this space of how can we help you? And then how can we also come together as a community to share resources and information and make this work easier for all of us because we're doing it together.
Well said. I think with that, we will close the session. And again, feel free to get in touch with us via the contact information. We'd love to hear